name's Ollie. I'm currently a Foundation Year 1 doctor at the Royal Cornwall Hospital in Trelisk. The average day would start with a 9 o'clock ward round. You tend to head into work a bit before then to prepare, so you come in about 8, start to build a list of your patients, and then you'll go around the ward on a ward round getting to know all the patients, any new issues that they have, any new patients that might be admitted, and you work out what you've got to do for the day. From there, the day will be a balance of pushing the patient care forward and making the right decisions, and doing practical tasks such as taking blood and fitting IV lines and cannulas. When I left school, I first went and did higher education in the north of England at Durham University, and then came down to the Peninsula. So started off in Exeter when I came down here for a couple of years, and gradually moved further down until I got to Truro, where I finished my studies and decided to continue working. The only way to get access to what I wanted to do was to go through higher education, and it broadened the opportunities available to me while building on sort of the education that I'd received at school. Not only that, but I think it was a great sort of social experience. I got to meet lots of new people, like-minded people, and get involved in all the activities that I enjoy. Obviously, the medical school is great. I think it's a fantastic course down here. When I chose the course I wanted to do, Peninsula was high up the list because of the type of course it offered, in that it gets you involved in patient care very early. You get to see patients from day one on your course, really, and you get a good clinical exposure down here. When I came down to Cornwall, I was worried that it might be a bit quiet, and I might feel a little bit isolated. But once I got down here, it actually doesn't feel like that. It's a very sort of active community. People are all very friendly, and it was in the right sort of part of the world that I was able to blend what I wanted to do professionally with how I wanted to live personally. And it feels like I don't have to sacrifice my personal lifestyle for my professional ambitions down here. The fact there's so many beaches within 5–10 minutes drive from here is wonderful. It meant I got the opportunity to learn to surf, which I always wanted to do and never had the opportunity. Something else that drew me down was the rugby in a little village down here called St Agnes, and people had talked about it being a nice environment, and it was great for me to continue something that I'd always done throughout my life.
Nice one, Sam!
I knew I had to do some time in Truro, and I actually put that off towards the end of my degree. Once I got down here, I think within about 2 months, I'd regretted the fact I'd delayed it so long. Investing in higher education paid off for me, because it gave me the opportunity to do the job I want to do.